day case and minimally invasive surgery, day surgery procedures. An increasing number of procedures in all aspects of surgery are being performed as day surgery. The key features that make a procedure suitable include low risk of major complications, predictable recovery period not requiring specialist postoperative therapy or treatment, postoperative analgesia that does not need routine opiates, anesthetic technique not requiring invasive monitoring, prolonged muscle relaxation, or epidural spinal anesthesia, low risk of difficult or unpredictable anesthetic technique. Many areas of surgery are now performed routinely as day surgery, including minor and intermediate anorectal surgery, hernia surgery, minor laparoscopic surgery, arthroscopy, and minor endoscopic bladder surgery. Selection of patients for day case surgery. Most hospitals have well-defined protocols to select patients for suitability for day surgery, and most day surgery units conduct their own pre-admission assessment either by telephone or questionnaire. Typical criteria might include maximum age of 75Y. This upper limit has gradually increased as familiarity with the procedures has grown. Appropriate social support for the patient at home, including transport and a responsible adult to monitor progress. No history of more than mild to moderate cardiac or respiratory disease, e.g. uncomplicated asthma or controlled angina. Non-insulin dependent diabetes only, unless for local anesthetic, LA procedures. Body mass index, BMI, below 35, typically, higher than this is associated with increased risk of anesthetic and surgical complications. Minimally invasive surgical procedures. Minimally invasive surgery is becoming more common in many areas of surgery. It is a broad term that includes many types of procedure, and there is much overlap with conventional open surgery, and at the other end of the spectrum, interventional radiological procedures. A useful definition of minimally invasive surgery is a procedure that can be performed by a technique involving fewer or smaller incisions than alternative conventional surgery or under less invasive anesthetic techniques. This includes most laparoscopic and thoracoscopic surgery, cholecystectomy, gastric fundoplication, colectomy, lobectomy, nephrectomy, adrenalectomy. It also includes flexible and rigid endoscopic procedures, diagnostic and therapeutic colonoscopy, cystoscopy, transurethral prostate surgery, hysteroscopic surgery, and several procedures using specific techniques or equipment, e.g. transanal endoscopic microsurgery, subfascial endoscopic venous surgery. Advantages of minimally invasive surgery. Many minimally invasive surgical techniques require specific training to perform and utilize expensive equipment and consumables, so surgeons and managers look to minimally invasive surgery to provide benefits to both patients and hospitals. Although some benefits can be achieved by modern post-surgical management, there are demonstrable benefits in different areas. Patient benefits: smaller, fewer, or absent scars, reduced time in hospital, fewer post-operative complications, particularly wound and respiratory related. Surgeon benefits: reduced post-operative stay, possible avoidance of the need for interventional anesthetic techniques such as epidurals. Hospital benefits: increased bed use efficiency, reduced post-operative complications. To whom should minimally invasive surgery be offered? The advantages of minimally invasive surgery give it a wide application. Young patients. Small scars and short hospital stays are ideal. Elderly. Reduced post-operative complications and shortened hospital stay are vital in patients who often have multiple comorbidities. Unpatient. Easier anesthetic techniques and reduced surgical stress may reduce the perioperative risk.